Hi, my name is Greg Fell. I'm Director of Public Health for Sheffield. It's a short piece on the vaccines. The vaccine's clearly coming. We've all read that in the press. There are two most likely candidates that will get over the line first. One is the Pfizer vaccine, which many of you will have read about. The second one is the AstraZeneca vaccine. Both are different vaccines, and there's a lot of clinical science to play out in how they get used. A few thoughts. To my knowledge, neither manufacturer has filed papers with the MHRA yet, so there isn't a licence application. So before we get to use these vaccines, they'll have to go through the licensing process, and MHRA are the body that gives licence. I think it's unlikely that there'll be significant quantities of vaccine being given to anybody this calendar year, 2020. There will be a few, but my sense it's unlikely that it will be large volume. Some of my team, and particularly the NHS, are working hugely hard on the operational arrangements to deliver the vaccine, so that when we do have significant quantities, we can go as fast as we possibly can. This will be an all-out effort to deliver as much vaccine as possible in as short a space of time. And the arrangements for that are being put into place now, so that when we've got the significant quantities of vaccine, we can do that quickly. My sense is, and this is a guess, it will probably take us 3 to 6 months to get a fully vaccinated population. The Joint Committee on Vaccination and Immunisations has set out the prioritisation schedule, and it's on their website. If you search for JCVI COVID vaccine, you'll find it really easily. And the starting point is care home residents and care home staff. On the premise that that's the most vulnerable group in terms of reducing mortality from this disease. The care home residents are clearly the most vulnerable group. NHS and social care staff are next on the list, and the premise for that is keeping the NHS and social care going. It's really quite important for lots of other reasons. And then the prioritisation is to work down the age order, and that's principally driven on the notion that age is the primary marker of severity of illness. So I don't know the detail on that, but I'm figuring that that's the justifiable prioritisation order as is set out. So we will be getting going probably just before Christmas at a fairly small scale, but certainly as soon as the vaccine is available after Christmas at a much bigger and much faster scale. What do we know about the vaccine so far? The end point in the clinical studies is symptoms. We don't know yet about the impact of the vaccine on transmission of the virus. Remember, it takes 28 days from the administration of the vaccine to develop an immune response, and that's the point that we'll begin to know, have some really real-life data on transmission. My sense is that there'd be unlikely to be any impact on transmission until we get into vaccinating large volumes of people. Hence, we're focusing early on those individuals who are most susceptible to severe illness. The last point to say is if both of the most likely candidates get over the line, then we significantly accelerate the implementation of the vaccine. So in summary, it's coming. We're putting into place the operational arrangements to deliver it as fast as we can. There are still some uncertainties about the science, and of note, both of the most likely manufacturers have to get a license application through. That will be done pretty quickly, and I think it will take us a minimum of 3 months, possibly up to 6 months, to get a fully vaccinated population. We will be going as fast as we can on that one.